Hello, and a warm welcome to Your Health Matters with me, Susan Mwongeli. Now, there's an interesting study that was released the other day by the Performance Monitoring for Action that stated that unplanned pregnancies had increased by 44% in the last 2 years. The report also went on to say that the use of contraceptives among married people had declined from 62% to 56%. And this has been attributed to a number of reasons, one of them being the coronavirus, because it limited access, and a lot of other reasons. Yet, it is the right of every woman to be able to plan her pregnancy. You might ask, which contraceptive should I use? Well, there's nothing like the best contraceptive because each has its own risks and its own benefits. So today, we will start a series on contraceptives, and we're going to start by looking at the birth control pill. What should you expect? Join me for this and more. And we have Dr. Maureen Owiti, who is an obstetrician gynecologist with a wealth of experience, over 20 years in medicine and over 10 years in the field of gynecology. Is that right? Yeah, so she's here to help us just unpack and learn the basics of the birth control pill. What types of birth control pills are there, and how do they work?
Interesting question. The most common birth control pill that is used is what we call, it's a combined oral contraceptive pill. We call it combined oral contraceptive pill because it has both estrogen and progesterone. The birth control pills, if I were to categorize them by category, there'll be those that have progestin only and those that have both estrogen and progesterone. Now, the progestin only are useful because initially after the woman has given birth, we never used to give estrogen because, again, this is a time women are more prone to clots. However, some studies are showing that it could be safe for them to use a combined oral contraceptive pill. There's also thoughts that it reduces breast milk production. So we tend not to use combined contraceptives during the first 6 months post-delivery for a woman. So we'd use a progestin only. So I like starting with the progestin only, just to explain. Now, the beauty about progestin only, it's a hormone, and that's the basis of how it's going to work, which should stop ovulation. So that's the premise that the hormonal contraceptives work on. All the hormonal contraceptives is that we're using methods to stop ovulation. If we stop ovulation, it means that there's no egg, which has been released, no egg released, the sperm swim, so conception should not occur. Now, with progesterone, there are other ways that it also exerts the contraceptive benefit, whereby it will make the mucus in the cervix. Remember we said that just before your period, the mucus becomes thick and dense and heavy. So that's the effect of progesterone. So you have more progesterone in the second half of your cycle. So again, making it that penetration of the sperm into the uterine canal very difficult. So primarily that's how the contraceptives work. So with progestin only, the challenge you have is, and the most common, is the issue of cycles. With progesterone, anything can happen to your cycles. So the most common change would be some people will not get their menstruation while they're on a progestin only method. Whether it's a pill, implant, the Mirena, they just don't get a period. So we call that amenorrhea. So don't get the period. Unfortunately, in some other people, we have the other extreme who now, because of the progesterone, will now start bleeding all the time.
So having said that, how do you know or decide which pill is good for you?
It's very difficult to know which pill is good for you. It's just to try and see whether it works. It's working for you. There's some people, the pill is working excellent. They're very happy. They're very happy with it. They're not having major side effects. So we continue. There's some people, as I said, like the progesterone-only, it causes menstrual disturbances. Anything from not getting the period to bleeding almost every day. And there's some people it doesn't affect them at all. They still have their normal cycles. So it's individual. So don't say that, oh, beshte yangu alikuwa na bleed saa yote, so I'm not going to use the pill. You must understand that we have very individual responses to the same medication. Now, we had talked about that's the progestin only, and I like talking about that first so that people now understand the difference of progestin only vis-a-vis a combined oral contraceptive. Now, if we add estrogen to the mix, you find that we now have regular cycles. So our expectation when we put somebody on a combined oral contraceptive pill is that they will have regular menstruation. And even a secret, I'm sure you've seen some people, they're being treated with a combined pill, those who are having issues with their period. So that's one of the treatment modalities. So we have the contraceptive benefit and we have the non-contraceptive benefit. So the non-contraceptive benefit would be somebody who's having irregular cycles. It may help them have more regular cycles. The only big challenge we have with estrogen is associated with development of blood clots. And blood clots can be in the legs, blood clots can be in the lungs. However, we would be more cautious in somebody who has a first-degree relative with a history of blood clots. So you have your mother suffered from a pulmonary embolism. I would be very reluctant to give you a combined oral contraceptive pill. I would say that let's think of getting something else. So it's always good. I know we sound expensive, but if you go to Kenyatta, we have an excellent family planning clinic. Our midwives there are awesome. And I'm sure all the healthcare workers out there, they're very good. So we just have like a checklist that we kind of like go through and determine from what you're telling us in your history, whether this is something you can do relatively safely. Understanding that there's nothing in this world that is perfectly safe. Even drinking, even just water. Too much water, there are floods, you can see people displaced, homeless because of too much water. And we know that water is something that is very good for you. So likewise, it's understanding why you're using contraception. You must first understand that. And again, understanding you as a person. Is this something I'd like? Personally, I'd never go for the pill because me taking pills every day, struggle. It's a struggle. However, yes. However, modern technology, you have a phone. You can put an alarm for every day at this time to remind you on how you're taking your medication or your pill.
What is the right way to take the pill?
Okay. I had a very interesting patient. She was taking the pill. So I asked her, so are you taking the pill? So her husband was working out of town. So she tells me when the husband comes, that's when she started taking the pill. Me, shock and horror, like, what? What do you mean?
That's not taking, Cindy. Why should you be taking when you're not partaking?
For the contraceptive pill, if you want to exert the contraceptive benefits, unfortunately, it's something you must take regularly. So the basic pill works in 21-day pattern. So you have 21 days of active hormones and 7 days rest. The rest can be inbuilt, whereby we'll give you 7 dummy pills. They don't have any active hormones in them. They have a different color. So they come as a pack of 28 pills. Or you just rest for the 7 days. We prefer the dummy pills from point of view. It gives that consistency and regularity in the cycle. However, if not available, there's no difference. They use the 28 or 21. Just that regularity you get by using the 21-day pills. So other than that population who we're worried about embolism, we should be able to use a pill and a combined oral pill. And as I said, it really helps. Other non-contraceptive benefits that we will have some acne, could be PCOS. Some people, the pill will help clear and balance their hormones and help clear their acne. So many other non-contraceptive benefits. The challenge with the pill is when you initially get on them, you may suffer some minor side effects.
How safe are they and how do they affect the body?
Okay. There's nothing in this world that is 100% safe. Having had said that, they are generally safe. That's why millions of women are using it and they're getting it from a health provider. It's understanding what do you want from this contraceptive pill, what are the side effects, so that you know when to stop or when to change the method. So it's something I'd recommend if it's something a woman is interested in taking.
Let's talk a bit about the failure rate. There are women who have been on this mode of contraceptive and they've gotten pregnant.
Yes. So with regular use, actually with correct use, the failure rate is at less than 1%. But we all know that with normal use, we tend to forget a pill here and there, and of course we're going to find ourselves pregnant. So it will be more than that 1%, but it's something less than 10%. Mm-hmm. So it should not be something that worries people so much.
Yeah. But you mentioned missing. So what if you miss 1 day, 2 days, 3 days?
1-2 days is not such a big issue. We would say just as soon as you remember that you have a missed pill, take that one and then continue using the other pills as usual. By the time we're going 3-4 days, you definitely would need to use some extra form. And we normally advise that they use a barrier method and then continue using. And then from the next cycle, they can now just use the pill alone.
When should a woman not take the pill?
A woman, we have absolute contraindications. So obviously somebody who has a personal history of having an embolic event, so that is like a clot legs, clot chest, 100%, they cannot be able to use the combined oral contraceptive pills. We have other contraindications are women who are obese, women who are smoking, obese, smoking, and people who have high blood pressure. High blood pressure will be relative, but again, I'd be very cautious to use a combined pill in somebody who's hypertensive.
Alcohol?
Alcohol also would be relative, but again, we don't seem to take that history very well because, fortunately, most Kenyans are social drinkers, so we're not those ones of 5 bottles or 10 bottles of alcohol on a daily basis. We binge over the weekend and the rest of the time.
Are you sure?
Yes, alcoholism is there. We're not whatever. If somebody turns out that they are an alcoholic, definitely would prefer to use something else because again, if they're not in control of the faculties, are they remembering to take this pill?
Mm-hmm, mm-hmm. Now, there's the emergency contraceptive, the e-pill. Where does it fall in this whole mix of birth control?
So I like the word of the use, emergency. So emergency contraceptive should strictly be for an emergency. So condom burst, now that's a person who should use an e-pill. Had a sexual assault, that's a person who should use the e-pill. But these stories we see that pharmacies are so busy. Friday night, Saturday night, they are busy collecting. Sunday morning, my e-pills are being collected like, I don't know what, candy. It's not pop candy, pop. It's not right, it's not wrong. The hormone levels in the emergency contraceptive are very, very high. They're not physiological. It's not good for your body to be having repeated doses. So if you must be taking it on a regular basis, just go in some regular form. It's hormone, you're getting higher hormones than you need. Exposing yourself to more risks than are necessary, just take a normal contraceptive pill on a regular basis.
But, I mean, yeah, it will make my cycle irregular, but will it work when I use the e-pill first, second, third? By the time, the 5th time, will it work?
Again, is it every day? Is it?
No, I mean this month, next month. But overall, maybe it's 5 times.
We've said for all contraceptives, there are failure rates. Even with conventional contraceptives, we have people who are pregnant. So working is that you are not pregnant, and that is the take home. Mm-hmm. Yeah. But even after taking an e-pill, someone may still be pregnant. In principle, it should work, but we would not recommend that is the way to go.
Taking it after 72 hours?
As in, we should take it within. Oh, we should take it within 72 hours.
I think I should have asked it.
Yes, yes.
Yeah, what if the 72 hours has lapsed?
Then definitely we cannot guarantee the efficacy of the method.
Should it be taken once or twice?
It depends. There are various things in the market. The latest ones is just once, but most of them were taking it twice after 24 hours.
So back to the monthly one. I got pregnant and aware I continued with these pills. Will it affect my baby?
Okay, so that's a very good question. And I've had several couples who come that they're using the pill and just reassured them that it's not a problem because, again, what is in the pill? It's estrogen, it's progesterone, which are secreted by your body. Maybe these are synthetic ones, but your body is producing something very similar. So fortunately, from what research has told us, it doesn't really adversely affect the newborn. And fortunately for me, for my clients, all of them, they obeyed the research. They have normal babies despite having taken the pill early in the pregnancy.
When you were talking about conditions of somebody perhaps going for the emergency pill was a condom burst. And it made me think, have you ever heard of people who, because condoms is another way of birth control, people who are allergic to the condom?
Okay.
Yeah.
So there are people who are allergic to a condom. Most of them is the material we use to make the condoms. It's latex. So some people have allergy to latex. We also have surgeons. The same material that's used to make condoms makes the gloves we use during surgery. So they have special gloves and special condoms that are latex free. So that's what we'd recommend in such a person if they still want to continue using the condoms.
All right, and I've been taking, say for instance, birth control pill for the last 10 years. Are there some long-term side effects?
Okay, so there's the issue of breast cancer, but it is a probability, but you find it's more common in people whereby that is something that's running in their history. So that's something that again we would explore and we'll be more cautious in somebody who has a family history of breast cancer.
Okay, and when you were talking, there's a question I remembered. Oh well, I think that one has gone and it's gone. But anyway, if you have any questions in regards to birth control, I mean, I'm sure we'll have a lot of other episodes where we talk about other forms of contraceptive, but this specific one is on the birth control pill. If you have any questions, please send them in and we'll be more than glad to ask Dr. Owiti, who will also be willing to answer them. But also remember, it's extremely important that when you're thinking of contraceptives, you go and see your doctor. This is just general information. It does not amount to a diagnosis or some real doctor kind of advice. So until next time, please subscribe to this channel and share this video far and wide so that we're able to reach as many people. Until next time, do take care of yourselves. Bye-bye.